Hello and welcome to the Pharma Forum podcast. I'm your host Eloise McLennan and I'm delighted to bring you another conversation in our special Frontiers Health series. Today I'm joined by Aline Noizet, founder at Digital Health Connector, who will be taking the stage at this year's Frontiers Health Conference, a global event which has become something of a cornerstone for innovation in digital health, therapeutic technologies and healthcare transformation. Now, 2025 is a bit of a special year for Frontiers Health as it is the 10th anniversary of the conference. And so to celebrate this decade of collaboration, meaningful conversations, we're speaking to key voices, old friends for the conference from across the industry. And in this series, we'll also be looking at standout moments from the past 10 years and looking forward to what's next for health and life sciences. So, Aline, thank you for joining us today.
Good morning. Very happy to be here.
If we kick off with a quick introduction. So for those of you who may not know, Aline, can you give us a snapshot of your role and the kind of work that you're doing right now?
Sure. So I define myself as Digital Health Connector. So that's what I do and what I am. So I've been doing that for 15 years. So connecting the different actors in the digital health ecosystem. We were focused on startups. So I really believe that innovation coming from the small companies can really have an impact. And my mission is really to help those companies to reach the people that need them the most. So especially healthcare professionals and patients. So with startups, it's really helping them to grow, to scale by connecting them to the right actors. And also sharing relevant international events with them, calls or innovation, so they can meet the people that will make a difference and help them grow and scale.
So Frontiers Health is pretty much an ideal place for those connections, those first fledgling conversations to start happening.
Absolutely, yes.
And so as we mentioned, you've been to Frontiers Health many times before. You're an old friend of the conference. If you had to pick a favorite memory or session or moment from all of the iterations of the conference that you've been to, what would that be and why?
So there's really many because Frontiers is very special and you always come back like very inspired every year. But one that was very special for me was, I think it was 2 years ago in Rome, was the keynote by Silvia Cerolini, the CEO of Eyes on the Future. So she gave a keynote on from patient to partners. And she was really talking about the importance of including patients in whatever you do, including them in the care team. And for me, that makes so much sense because I really believe that as patients, as people, we have so many data inside of us and we know ourselves better than anybody else, the way we feel, the symptoms that we have. And that's why I feel it's so important. So that discussion was really meaningful. And her keynote was also very powerful because she shared a personal story as a mom caring for a kid with a rare disease. And she also shared how she was looking for innovation that can help her daughter with that rare disease. So finding technologies or innovation that could help accelerate the research and development for that rare disease. And that spoke to me so much because it reminded me of why I'm doing what I'm doing and why I wake up every morning, just for those type of examples to see how people can really benefit in the impact that solution can have, like on patients, on healthcare professionals, on the system. So I think that's very, very valuable.
I know exactly the keynote that you're talking about. And if I remember correctly, she spoke about the fact that the smaller outlets, the ones that you work with, can oftentimes have the focus, the motivation, and the personal connection that gives them the time and energy to focus on one specific condition, one indication, whereas a larger company may have struggled to find the resources for that singular focus.
Absolutely.
So talk to me a little bit about the frontiers from the past. I want to move to now for you. Can you give us 3 areas that you're working on and you're most focused on right now?
So the first one that I'm very involved with at the moment is adoption of digital solution in hospitals. So I look at it from 2 sides. So first, the startups to help them understand what is required to enter and be adopted in a hospital. So looking at regulation, technology, clinical needs, and business. And I'm like a mentor for them to challenge them to make sure that adoption is actually successful. And then the other side with the hospitals, it's first to help them understand what are the unmet needs and what type of solution they need. And then to help them with innovation procurement. So hospitals, especially public hospitals, when they want to adopt a solution, they need to go through procurement. And in those past years, there were a new set of tools that have been designed to help new types of solutions, like digital health solutions, to be adopted by hospitals. So that's innovative procurement. So that's what I'm helping the hospitals to be aware of those tools and to use them to facilitate the adoption of the solution. The first focus is also a bit related to that, is spreading the word about innovations and solutions to healthcare professionals. So that's really one of my favorite activities. So I'm not really talking about the healthcare professionals that we see at conferences like Frontiers, but more the healthcare professionals that are at the hospitals, like working full time with patients, and they don't always have time to go to conferences or to check what's out there, what are the technologies, and we know that it goes fast. So those sessions, it's really to give them an overview of what's happening out there in their specific specialties, and to give them an idea of how those solutions and those innovations can empower them, can support them in the day-to-day, and work with their patients better. And something that I do also in that line, it's more, I'm sharing my own experience and do reviews about more consumer health solutions. And I share them with my community. So I've been wearing the Oura Ring for 2.5 years. So I do reviews about that, so people understand how I've been using it and the impact it has had on my life. And the more recent one that I did was my experience doing a genomic test with my hospital here in Spain. So the results that I got and what it means for the future. So those topics are more focused on innovation, on prevention and personalized medicine. And the third focus, me being a connector, is building ecosystem. So that's like more an umbrella work. But when you connect the different actors of the ecosystem, it means to keep up to date with what is happening. So mapping the different actors, like knowing who is doing what, being in touch with those people to understand what they're working on, what are their priorities. So I do that through a lot of one-on-one conversations, but also organizing events or webinars and being involved in different international conferences like Frontiers or innovation programs.
Frontiers Health, as we've been talking about digital tools and digital solutions for a decade now. So what are you looking forward to seeing at this event? So we've talked a little bit about the surface level in prior conferences, a little bit more about the practical reality of delivering those digital tools, those digital therapies. And now that it's somewhat matured as an area, what are you looking forward to the conversations being this year?
So I really would like to see use cases of adoption, like, in the case of hospitals, for instance. We need to see that. We need to motivate the actors like startups and hospitals to see that this is happening, and to really see the impact that those solutions are having within the hospital. So that's something we discuss a lot. But if someone can share, like, we've been saving X million every year, or this how it has been improving our patient life across Europe. Nothing. We need to see different examples in different countries. That's what I would like to see at the conference.
And just to wrap up, can you give us a word or a phrase that for you captures the next era of health innovation?
Collaboration.
Why collaboration? Why collaboration?
Because I really believe that the future of healthcare is going to go around ecosystem. So this is also what I've been doing for many years, but I think it's important to make all the different actors around the table. So we were talking about the patients before, really having the patient as part of the care team, not just someone like we talk to, but have them fully involved. And the same with the rest of the actors, no? Because if you look at it, pharma, insurance, hospitals, they have common needs and common unmet needs. And having them in that same conversation, instead of people like doing their things in their corner, if we bring forces together, it's just going to have a more powerful impact for the healthcare system and for all of us.
Giving everybody a seat at the table.
Exactly. Yeah.
Fantastic. Well, thank you so much for joining me today. I'm really looking forward to seeing you at Frontiers later this year, as I'm sure our listeners will as well. That's all for now. Thank you so much for tuning in. Aline, thank you again for joining me. And stay tuned for more interviews for Frontiers Health. Thank you very much.
And that concludes another episode of the Pharma Forum podcast. You can find more information about this episode, including a download link and information about previous installments at pharmaforum.com/podcasts. The Pharma Forum podcast is also available on Apple Podcasts, Spotify, Overcast, Pocket Casts, Podbean, and pretty much wherever else you download your other podcasts from. Just search for Pharma Forum and follow and hit subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us on Blue Sky and LinkedIn at Pharma Forum. That's all for now. Thank you for listening.